All right, guys, welcome to the Fit Podcast. So obviously it's just me. Yusuf isn't on tonight. I don't have any other guests. So tonight is going to be a physical therapy specific episode. What I want to talk to you guys about, and I think it's really important for not just athletes, bodybuilders, powerlifters, dancers, gymnasts, etc., but for everyday people. How long does it take to recover from an injury is the most common question that I get asked daily at my job. Um, and just from clients of my own. And I hear from everyday people, family members, etc. How long will that take to heal? How long will that pain take to go away? So we're going to kind of run through what happens when you get injured, um, and then just kind of go through the basic timelines of the different types of injuries to different parts of your body and how long those can kind of take and the different grades and kind of distinguishing between the different types of grades that I find to be very helpful. So tonight, I kind of thought about this because we have been talking a lot about like nutrition and diet and exercise and things like that. And we haven't necessarily dived into the PT's perspective on healing times and healing and just overall what happens during that. And I think that's important for you just guys to know the bare minimum basics. We don't need to go into super detail and go into anatomy and phys as much as I want to geek out on that with you guys. We're not going to do that tonight. Um, but I am going to go on and kind of into the basics. So let's start with an example. Let's say you're walking down the street, a little bit icy, like tonight actually in Chicago. It's actually pretty icy right now, and snowy. But let's say you're walking down the street a little bit icy and you twist your ankle and it goes like this, and you have immediate pain. You fall down. You just immediate pain. There's some swelling. There's some inflammation that's going on in there. And then you can't walk on it. You're limited, and then you're kind of wondering, okay, what's the next step? Or what's happening in my body? If you recover from that, you kind of sometimes may think, okay, what actually happens when that occurs? So when the tissue heals, there's four different stages that it goes through: hemostasis, inflammatory, proliferation, and maturation stage. Those are the four stages of healing. What each stage basically does is a quick rundown. Is in the first stage of healing, hemostasis basically means stopping the flow of blood. This is the first stage of healing. Hemostasis basically is when like the blood vessels constrict to restrict the blood flow, and they basically stop it. And then you get coagulation, which is just like platelets coming together through like different types of connective tissue to stop the blood flow. Inflammatory stage is basically it's the second stage of wound healing, and it begins right after the injury, right after hemostasis. And it's kind of concurrent, but it basically just controls bleeding, prevents infection. There is going to be some swelling, but it's just taking some time for the cells to kind of repair themselves, kind of clean the wound out, make sure there's no signs of inflammation or infection that can occur. I mean, sorry, not inflammation, infection that can occur. The third stage is proliferation, and it's basically just means reproduction of cells. So you're basically just reproducing new connective tissue, collagen, just different types of cells to obviously make the wound sound again. Um, and then the last stage is really maturation, which is what you might hear as like the remodeling stage. It's the final stage. And basically like the collagen and connective tissue fibers are basically remodeled. They're matured and the wound is fully closed. There's no inflammation left. There's no swelling left. It's kind of all gone down. Now, to get to those stages, obviously, and to get to that last stage, that takes a little bit of time. It may depend on your injury. But those are the natural steps of progression for an injury um, that occurs. Now, how long each stage is going to take depends on the severity of your injury. So we're going to kind of go through that. I will also make a post on the podcast so you guys have a chart that I made for you guys to have access to. Um, and I'll also kind of post subsequent shorts so it kind of makes it easier so you kind of can understand. So the like the content is shortened, so the important stuff is there in shorts. But before I go on, I want you guys please like, comment, subscribe to the channel. Really, please subscribe. It helps me grow. We're trying to bring on bigger name people, and before I bring them on, I just want to get more subscribers just to build the brand up and the name up. And just so you guys know, we are coming out with a website or I am coming out with the website. So if you guys are interested in any or have any questions for me, need help with or want an assessment, want help with pain that you have, wherever body part it may be, you want some weight loss coaching, you want nutrition coaching, you want powerlifting coaching, you want just to kind of lose some weight, get some muscle on. I'm going to be building a website here in the next couple of weeks, coming out with a website in the next couple of weeks that's going to really bring that all together. So I'm really excited about that. So again, ankle sprain. Let's go back to that scenario. You twist your ankle and you're kind of wondering, okay, how severe is it? How bad is it? How long will it kind of take to heal? I'm a little bit nervous about this. So um, typically with healing time for if you have a ligament sprain, which is typically what, when you twist your ankle, you sprain a ligament. That's typically what it's called. Typically, a grade one sprain I would consider to be swelling, but minimal, and it kind of starts to go down after a few days. It's not severe. You can still walk on it. You can still do your activities of daily living, but it's not super comfortable. That can take 2 to 8 weeks typically. The more severe grades of sprains for ankle, for example, I'm just giving an ankle, for example, okay? But just in general, even for the knee, hand, wrist, whatever, any joint has ligaments attached to it. So you can sprain the ligaments in any joint. But typically when it's more of a grade two, typically takes 2 to 6 months, and that would be where the swelling just takes a very long time to go down. You really can't do anything. Any walking, weight bearing is painful. You're typically probably be in a boot of some sort, crutches. It would be very uncomfortable. Um, and the swelling will kind of persist for a long period of time. And there'll be a lot of discoloration. You may also have swelling that's kind of residual, kind of going up the leg as well too. So that will be very uncomfortable. Um, grade three is where you will need a surgery. And it usually is 6 to 12 months. That's basically close to a full tear of it. I would say grade two is kind of like maybe a partial tear, but I would definitely say grade three is a full tear of that ligament. And that can take 6 to 12 months, if not more than that. So now, if you're talking about specifically muscles, if you strain a muscle, how long is that going to take? Or if you tear a muscle, how long is that going to take? All I say is this is the most common word. It depends. It does depend. Depends on the muscle that you tore or partially teared or strained. Um, Specifically the activities that you're trying to get back to doing. Like for me, powerlifting, if I'm trying to squat and I tear my quad and I'm trying to get back to squatting 750, that's going to take me a lot longer to do than if I tear my quad and I'm just trying to get back to walking. So it depends on what you're trying to do, I would say. But either way, just to normal function for everyday people, typically a grade one is 2 to 4 weeks. What that means, a grade one strain is just like, you ice, you heat it. After a couple of days, you start to seem to kind of get better. You get a little bit more range of motion. You can kind of put weight on it. But the activity that caused the injury, you still can't really do. But over time, over a week or two, a couple of weeks, you start to be able to kind of progress that activity and get back to what you're doing. There's no swelling or inflammation or anything like that, discoloration. A grade two muscle strain is a little bit more severe. Usually takes anywhere from 8 to 16 weeks, so that could be 2 to 4 months in months time frame. That's where it's a bit more severe. That could be partially a partial tear of the muscle. That could also be some tendinosis developing, and that would basically be more tendinosis is more. tears in the muscle fibers themselves, unlike tendonitis, which is just tendon has little microfiber tears. Tendinosis is when the muscle belly starts to kind of develop and the tendonitis is kind of spread to the muscle and now it's tendinosis. So that's why when you see NBA players and they say tendinosis of the calf or Achilles, that's when they're kind of get very skeptical and push them back because tendinosis can easily develop into a full tear. You can kind of go tendonitis, tendinosis, and sometimes players might even not know they have tendonitis. It might just be kind of like some cramping, pain, whatnot, kind of pain here and there. Not just for basketball players, but runners, football players, etc., athletes in general. That tendonitis, tendinosis can progress pretty quickly depending on what specific sport you do or activity. So, and then grade three, muscle strain of the full tear usually takes 9 to 12 months. And like I said, that varies depending on what you're trying to do and what your goal of getting back to what your goal is to get back to what to do. Um, then when you have tendons, so if you guys remember, okay, ligament, what is the ligament attached to? Bone to bone, tendon, bone and muscle. So it's kind of like that barrier. Um, so typically, I deem this is where we get into tendonitis, tendinosis. 2 to 6 weeks, I typically deem is acute. That's acute tendonitis. That's what I call it. Um, and there's different stages of tendonitis, but I won't get into that necessarily in different grades. But I typically, my just general rule of thumb, once you get into the higher stages, I think there's like 4 stages of tendonitis, you pretty much have tendinosis at that point. It's pretty much close to it. Um, but the first, 2 to 6 weeks, more tendonitis. It's acute. Typically, this is just kind of nagging pain that kind of goes on. It's not going to affect your everyday, all your activities that you do, everything that you do. But with those specific activities that require you to load that specific tendon, wherever it may be, whatever body part it may be, that's where it's going to kind of be painful. To deal with for that persistent period of time. You'll need to kind of rest it, avoid that activity, and then to start to get better. Um, then what I start to say is subacute is more 2 to 4 months. That's where we kind of start to get into that later stages of tendonitis, where we get the tendinosis, where it is just very starting to kind of go into the muscle belly. The microfiber tears and the tendon starts to have microfiber tears as well, tendonitis is, and that's becomes, it can very much easily so become chronic, and it's kind of affecting almost all your activities that you're doing. Um, there's some positions that you can kind of do or things that you can do to calm it down, but for the most part, walking, weight bearing, if it's a lower body, any arm overhead lifting, any movement, anything you got to lift or carry in your hands or, do anything with your lower extremities that's going to really aggravate it and make it worse. And then chronic is usually where, in my opinion, becomes surgical, and it's usually a repair for a full tear or rupture, and that usually takes anywhere from 9 to 12 months to heal, is typically what I found. Um, so now, like I said, these can vary. So it's not all, everyone has different time frames. So I think that's a big thing is that everyone does have different time frames and what research shows. So it varies. It varies. But for the most part, that's kind of what I've found myself. Um, then we got bone. So bone, different types of bone injuries. I typically say um, bone could be as much of a fracture as it could be a bone bruise. Bone fracture, I typically say 6 to 12 weeks, depending on the fracture, but specifically for the fracture to heal necessarily. Um, that doesn't mean that it's going to be stabilized for you to get back and doing what you do, but typically for the fracture to heal, obviously after surgery, that's how long it would take. And then it's really getting it allowing, that's not, doesn't mean it's stabilized, but then you got to work on the stability, the strength, range of motion, all those different types of deals, the endurance of the muscles around it, tendons and ligaments, be able to maintain that stabilization and provide that stability um, and control and time under tension, etc. So bone bruise, typically this is I see it a lot with falls in patients. Um, Bone bruises do take a little bit more time because if you don't know, bones have blood. So when you do get things like um, so when you do have direct contact or trauma or a fall, um, I typically, and there's no swelling to the eye. There might be some swelling, but then it's like you feel like a deep pain when you touch your hip or your hand. I typically say that's a bone bruise. It's signs of bone bruises. It's deep bruising within the bone itself. Because if you don't know, um, like I said, bones do have blood flow to them. So um, that is important to know that I do think that people don't always take into account. And what can happen, obviously, if we do not get enough bone, is we get some avascular necrosis, which is basically just where the blood flow to part of the bone is basically reduced, and it can cause the bone tissue to die. And your bones do have tissue as well, if you didn't know that. So, um, and then let's see, cartilage. That's another one. I typically say 9, maybe almost 1 to 2 years to kind of recover from and get that healed up. And then obviously nerve damage, which is very uncommon. I mean, it's not uncommon, but it's less of the ones that I listed and went through. Regrowth rate is typically 3 to 4 millimeters a day, depending on the severity and the injury. So there's different types of nerve regeneration, and that just depends on how severe the nerve injury is, and the extent. So, but I think an important thing to realize is um, some factors that impact pain and healing. These are very important things. So, I always tell patients it's never good to compare yourself. Oh, my uncle healed from this ACL repair in 8 months, but it's taken me 10 months. Why is that? Everyone's different for a multitude of different reasons, hereditary, genetic, um, things that you're predisposed to, things that you have going on, previous injuries, um, endocrine, cardiovascular, muscular disorders, neuro disorders that you may have that are impacting your ability for your body to heal, and the pain level to go down. So I'm just going to run through some things that I see very common of things I want you to take. These are general factors that impact pain and healing. So cardiovascular disease, venous insufficiency, infection, diabetes, especially for problems with the kidneys, eyes, feet, and nerves, decreased sensation. Metabolic deficiencies are very common. Severity of injury, obviously, depending on the grade of sprain, strain, etc. And then another one that I tend to say is very important is also emotional mindset. So how determined you are to get back to doing what you're doing. If you're not determined and you're kind of down because you got injured, it's going to affect your ability to want to get better and put in the effort to get better as well. Um, So, I mean, I know this is kind of a short podcast, but I didn't want to go into too much detail and overwhelm you guys. But just kind of that was really just kind of a rundown of what, again, the difference went through kind of the different stages of healing, the 4 stages. Um, Hemostasis, inflammation, proliferation, and then the last one, maturation stage. So we kind of went through those, well, just the basics. Again, I will make a couple posts about that specifically, so you have access to that. So you kind of, if you're interested, and it's a quick little read, a minute read, if last, I'll have a 30-second read. You can have that access to that. So, but then we also talked about the different timelines of different injuries. We gave an example, ankle sprain, kind of talked about that, and kind of distinguished, different types of grades of injuries as well. I will also make a post about that, but different timelines as well too. Again, like I said, my timeline is not perfect. Every PT might have a different timeline. A lot of that is based off of what they see in their experience in the clinic and also what they learn. So, and I'm not to say that everyone's learning something different in our physical therapy field. That's not true. But um, there is for majority there is like a specific date and time and like dates of how long an injury is going to take, but some people get very specific, and then that's where the variability can occur. And then lastly, we would talk about some things that can affect healing time, things that are genetic, hereditary predispositions, medical conditions that you do have right now that could affect your healing time, whether they be endocrine related, metabolic, cardiovascular, musculoskeletal, and even previous injuries that can affect your healing time. So, with that, you guys, quick episode tonight. Please, please, please subscribe to the channel. I really would appreciate that. Um, like I said, we're trying to grow the channel, and I'm really getting into this. I mean, I've already was into it, but just always having new ideas of how to improve the content for you guys. Because I don't think there's not I haven't really seen this type of information out there. Obviously, I know there's other people who have physical therapy channels who just give exercises and things like that, but actually talking to you guys, speaking to you about our own experiences, our own analysis, our own knowledge. And then also, and I am trying to have you guys engage with me. So please comment any topics that you want us to talk about, any pain questions that you have, questions in general about losing weight, eating healthy. Should I eat this? Should I eat that? What's the best time to eat this? What's the best time to eat that? How do I lose weight? What are the first things that I should do? Please comment that. Subscribe again. Please like. And other than that, guys, I want to wish you a great, happy weekend. Have a great night. And thank you for watching. Don't forget to subscribe, you guys. Don't forget to subscribe.